working at the international level and having the privilege of being able to travel to many different countries around the world and seeing, how they approach some of these health problems and health challenges, that gap between people who have access to healthcare in general and people who do not have access to healthcare. And so when we're talking about World Cancer Day and we're talking about access to cancer care, in general, we're also talking about access to health. One of the biggest gaps is if you do not have access to medicines on that essential medicines list, if you do not have pharmacists, physicians, nurses who are trained and well-trained to be providing that high standard of care, then you really lose the opportunity to have health services in place to meet the needs of the patients. That cancer care gap has to do with the capacity of the whole healthcare system. It has to do with the ability to access medicines that are really essential, not just for cancer, but across the board. In the work that I do with the United Nations Office on Drugs and Crime, we have a particular focus on controlled medicines. And so for cancer patients, that really reflects the ability for them to have access to medicines in cases where they may be in extreme pain, they may have anxiety, any of those kinds of issues related to cancer care are typically managed or prescribed essential medicines that are controlled medicines. And so again, it goes back to that care gap where we need to make sure that providers of healthcare are well trained and that are making decisions with the patient at the center of the decision, not the money, not the needs of the government, not the availability of the actual medicine. It needs to be patient-centered in a high quality and safe way.